Hi, I'm CHSAA Commissioner Mike Kruger, and I want to welcome you to the Colorado High School Activities Association's Head, Heart, and Heat video training series. We are very grateful for the positive impact you have on our kids and the significant role you play in their development. Our mission is to create a positive and equitable environment in which all qualified student participants are challenged and inspired to reach their highest potential. To do this effectively, we know that we must have a strong focus on participant health and well-being. The Colorado High School Activities Association has long been a leader in high school sports and activities. Our mission and vision guide everything we do, emphasizing the importance of creating an environment that is physically, mentally, and emotionally safe for all participants. Safety and risk minimization are the cornerstones of our efforts. It is critical that we not only provide environments where every student can thrive without fear of injury or harm, but also one in which the caretakers in charge feel comfortable and competent handling safety-related situations. This series of short videos is designed for school personnel, coaches, students, and parents. By watching these videos, you will gain valuable insights into best practices that enhance participant health and well-being. When it comes to sports medicine, CHSAA has continually been a proactive leader, not only in our state, but also in our country. We recognize that while we cannot prevent all injuries, we can provide education that minimizes their impact. The CHSAA Sports Medicine Advisory Committee continuously updates our membership with the most current practices. Collaborating with state legislature, we have established requirements that protect our students. Today, students are better protected than ever before, thanks to a mix of CHSAA bylaws and state statutes. Along with the Head, Heart, and Heat video training series, you will also find educational videos on pre-participation physical exams and emergency action plans. Our membership bylaws require physical exams and parental consent before participation, along with protocols for students removed from play due to injury. Each school must have a venue-specific emergency action plan for every facility used for athletic competition. State statutes supported by CHSAA personnel mandate training in the use of AEDs and CPR, concussion education, and other critical areas for student participation in athletics and activities. Thanks to the proactive approach of the CHSAA Sports Medicine Advisory Committee, students continue to enjoy a better and safer experience in their athletic endeavors. Thank you for your commitment to our students' health and safety. Together, we are making a positive impact and ensuring a brighter, safer future for high school sports.
Hi, I am Dr. Brooke Pangel, a primary care sports medicine physician and member of the CHSAA Sports Medicine Advisory Committee. In the next few minutes, we will cover the essentials to help you understand, recognize, and manage concussions effectively. First, let's start with, what is a concussion? A sport-related concussion is a traumatic brain injury caused by a direct blow to the head, neck, or body during exercise, which causes the brain to move rapidly within the skull. This can disrupt normal brain function and lead to various symptoms. Recognizing a concussion is crucial, but can be difficult as no two concussions are the same. Symptoms vary in how they affect the athlete, the severity, and how long they last. Symptoms commonly include headaches, dizziness, nausea, confusion, and sensitivity to light or noise. It is also important to note changes in behavior or mood, memory problems, and difficulty with concentration. It is not uncommon for symptoms to be delayed and develop over hours or days after the injury. If a concussion is suspected, it is important to act quickly. Remove the athlete from play immediately. Continued participation can worsen the injury and increase the time it takes for the brain to heal. Follow these steps. 1. Assess the situation. Check for any immediate signs of severe injury or distress. If severe symptoms like loss of consciousness, repeated vomiting, or severe headache occur, seek emergency medical attention right away. 2. Inform and monitor. Inform the athlete's guardians and ensure they are monitored for any worsening symptoms. 3. Seek professional evaluation. The diagnosis and management of concussion must be made by a qualified medical professional per Colorado state law who is aware of the comprehensive nature of the problem and provide guidance on the appropriate recovery plan. Colorado state law defines a qualified medical professional as a doctor of medicine or osteopathic medicine, MD-DO, licensed nurse, practitioner, licensed physician assistant, licensed doctor of psychology with training in neuropsychology or concussion evaluation and management, licensed physical therapist with training in pediatric neurology or concussion evaluation and management. Remember, when in doubt, sit them out.
Hello, my name is Jim Keller. I'm a licensed athletic trainer and member of the Sports Medicine Activity Committee. Concussion management, treatment, and return to play is focused on the health and safety of the athlete. Recovery is crucial. Athletes should follow a gradual return to learn as well as return to play protocols. Return to learn involves stepwise progression developed collaboratively between the student, athlete, teachers, parents, counselors, and qualified medical professionals. Colorado state law mandates written documentation from a qualified medical profession for clearance to begin a return to play program. This clearance is not a release to return to full sport activity, but rather a release for the athlete to begin a return to play progression. The return to play steps must be supervised and the athlete monitored and/or directed by medical personnel. A return to play progression is designed to assess brain function with increasing physical activity and mental exertion. Ideally, the athlete will work in conjunction with a licensed athletic trainer through their return to play. If resources allow, baseline testing can be done in preseason to assess the difference in brain function before and after the injury. If medical personnel are not available, the athlete must return to the physician upon completion of the return to play program for a final return to sports clearance. The return to play protocol progresses as follows. Stage 1, symptoms limited activities such as walking, being with family and friends, and attending school. Stage 2A is light aerobic exercise up to 55% of max heart rate for 20 minutes and increase as tolerated. Stage 2B, moderate aerobic exercise up to 70% of the max heart rate for 30 minutes and increase as tolerated. Light resistance training may be started if signs and symptoms are not present. Stage 3, individual sport-specific training. However, no activities that allow risk of head impact. Stage 4, non-contact training drills that progress to high-intensity training and can integrate into the team environment. Stage 5 is full contact practice consisting of normal training and sport activities. Stage 6 is return to sport and normal game play. Athletes may progress through no more than a step per day. If symptoms return at any stage, the athlete should wait 24 hours, and when symptoms are no longer present, the athlete may attempt the previous step that was completed without symptoms. Education is key. Ensure athletes, parents, and staff understand the importance of reporting symptoms and following protocols. Remember, the long-term health of the athlete is paramount.
I am Dr. Christina Wilson, a primary care sports medicine physician at Children's Hospital, Colorado. This video is to help schools, coaches, students, and parents focus on safety and participation. This video addresses the heart. Sudden cardiac arrest is a sudden stop of normal heart function. This is often caused by enlargement of the heart or abnormal electrical activity of the heart. This is a rare but very serious event that may result in death. It is important for all student athletes to receive a yearly pre-participation physical examination by a doctor or other qualified healthcare professional to allow them to perform a detailed cardiovascular assessment of the student athlete. Cardiovascular issues are often genetic, and there may be early signs of heart conditions that can be detected through a comprehensive history and examination. The healthcare provider will check for conditions like an irregular heartbeat, a heart murmur, or other heart abnormalities that could require further testing. When submitting your annual physical information required by your school, it is important that this history is complete and accurate and provided to both your doctor and the school where you participate. Any heart event that occurs should be considered a medical emergency. Appropriate steps should be taken immediately. Early recognition and rapid response are critical to treating any heart emergency. Oftentimes, in young adults, there may not be any warning signs. They may just suddenly fall over. If a heart emergency occurs, call 911 immediately, begin CPR, and retrieve the AED. Continue until emergency personnel arrive.
AED is an important piece of equipment during a sudden cardiac arrest. AED stands for Automated External Defibrillator. If an athlete experiences sudden cardiac arrest, call 911 immediately. If an AED is available, it should be applied to the athlete's chest and will assess the heart rhythm. If the AED detects a shockable rhythm, it will advise you to stay clear and press the button to provide a shock to the heart. If no AED is available, CPR should be started immediately. AED use within the first 3 minutes, along with CPR, has a very good success rate. Every minute this is delayed, survival decreases by about 10%. Every school should have a fully developed venue-specific executed emergency action plan, also known as VEAP, VEAP, that addresses essential personnel, essential training, and the essential equipment available during an emergency. There should be an EAP for all practice and event sites. The emergency action plan should be rehearsed at least once a year, and again, communication between school personnel and emergency response personnel is critical. Emergency action plans prepare you for the worst-case scenario. A well-established, rehearsed EAP allows our sports medicine team and emergency responders to best serve the students in an environment that can often be disorganized. EAPs are important for practice and games at every site that may be used. Things that need to be included in an EAP include a duty list of who's calling 911, who is addressing the initial medical emergency, whether that be the athletic trainer, team physician, coach, or administrator. It is paramount to know how an ambulance will gain access to the student in need. This includes knowing through which gates to enter the facility and how to get to the emergency in the most efficient manner, because in these situations, seconds matter. While having a plan in place is crucial, it is also important to practice the details of the plan so that in the event of an emergency, things flow smoothly. An annual or semi-annual rehearsal is absolutely needed to ensure the execution of the EAP. It is important to have an AED available to all sporting venues that can be obtained within 3 minutes. For most schools, this means having more than one AED available to be used by anyone. It is also important that these life-saving devices are not locked up. Many are stored on a case attached to a wall and should be accessible to all. It is important to be aware of the location of the nearest AED to each field, gym, and/or facility that you use. Colorado High School Activities Association requires all students who participate in athletics to receive a pre-participation examination, also known as PPE, prior to participating. In August of 2025, CHSAA will mandate a standardized PPE form be used and turned in by each athlete prior to participation. CHSAA also requires all coaches to obtain certification in AED and CPR, as well as requires all schools to have an EAP for each athletic venue the student athletes use. In summary, key points to remember: ensure a well-established rehearsed EAP is in place for each athletic venue. Early recognition and rapid response are key to saving a life. Provide an AED within 3 minutes of any and all athletic venues. It will instruct you how to use it. Anyone can use it, just turn it on and follow the prompts.
How do we prevent and treat heat illness? Number one, as in all emergencies, have a venue-specific emergency action plan in place, know it, and practice it at the start of every season. This allows for seamless life-saving management in the setting of an actual emergency. Number two, monitor the environment regarding heat and humidity and modify practice or games ahead of time for anticipated hot conditions. The standard of care is to use a wet bulb globe temperature using a wet bulb globe thermometer, which takes into account temperature, humidity, wind speed, sun angle, and cloud cover. If not available, many weather apps can at least take into account humidity using the heat index. Number 3, adjust workload and equipment in high-risk conditions. This may include lower intensity practice, less equipment, or moving the practice or game to a cooler time of day. Number 4, conduct warm-ups in the shade and allow for breaks in the shade. If no natural shade is available, consider using portable tensor shades. Number 5, all coaches need to closely monitor their athletes for signs and symptoms of heat illness when training in the heat. Number 6, acclimate athletes gradually to the heat. Please see the heat acclimatization section of the CHSAA handbook for further details. Number 7, mandate scheduled rest and hydration breaks during practices in the heat. The higher the wet bulb globe temperature, the more breaks will be required. Number 8, teach and practice appropriate hydration methods. And number 9, ensure that personnel and facilities are equipped to handle a heat stroke emergency. Begin to rapidly lower the core body temperature if mental alertness is compromised and heat stroke is suspected. The standard of care is to submerge the athlete in an ice bath. However, if no ice bath is available, a good alternative is to wrap the athlete in a tarp with ample ice inside. The tarp-assisted cooling or TACO method. Remember, heat stroke is dangerous, but it is 100% preventable if appropriate planning, early recognition, and intervention is utilized.
Heat illness may occur in athletes exposed to excessive environmental heat. Heat illness can present as heat cramps, heat exhaustion, or heat stroke. Heat cramps are a form of heat illness characterized by muscle spasm after prolonged intense exercise in the heat. The cause is unclear, but are thought to result from fluid or electrolyte loss from sweating fatigue of the muscle. Heat exhaustion, the athlete will perceive discomfort such as fatigue, nausea, dizziness, etc. as the body temp rises. It's key to recognize these signs and symptoms early to prevent progression to heat stroke, which results in more severe symptoms. Heat stroke is severe heat illness with elevated core body temperature that results in changes in mental alertness. Heat stroke is a true medical emergency that requires immediate action and can lead to permanent disability or death if treatment is delayed. Heat stroke is the second leading cause of death in athletes, only behind sudden cardiac arrest. However, unlike causes of cardiac death, heat stroke is 100% preventable. The risk factors for heat illness include hot, humid weather, inadequate athlete preparation with poor fitness level or insufficient acclimatization to the heat, excessive physical exertion, dehydration, overweight, heavy clothing, uniforms, or equipment, or sickle cell trait and disease.
Hi, I am Dr. Brooke Pengel, a primary care sports medicine physician and a member of the CHSAA Sports Medicine Advisory Committee. In the next few minutes, we will be discussing medical clearance for student athletes. The pre-participation physical examination, otherwise known as the PPE, is a structured health visit with the purpose of screening for orthopedic and medical conditions that could predispose to injury, illness, or life-threatening conditions. There is a standard approach to the PPE. The structured format and PPE forms were created by the American Academy of Pediatrics, the American Academy of Family Medicine, as well as multiple prominent sports medicine societies. The PPE is endorsed by the NFHS and NATA. The PPE forms include 3 sections: the history, physical exam, and medical eligibility or clearance. The CHSAA Sports Medicine Advisory Committee recently finalized an updated version of the PPE forms that are now tailored to the needs of Colorado schools. The 2024-2025 school year is the pilot for these forms, with full integration in 2025-2026. That is, by 2025, the standard PPE form will be the only form accepted by member schools for medical clearance. Per CHSAA bylaws, the PPE needs to be performed yearly by a licensed medical practitioner. The qualifying providers include medical doctors, doctors of osteopathic medicine, nurse practitioners, physician assistants, and doctors of chiropractic medicine who are school physical certified. On the CHSAA website, there are links as well as a QR code for the PPE forms so they can be easily accessed and downloaded. Additionally, there is a checklist for parents detailing the following instructions. First, parents need to download the PPE forms and complete them with their student athlete before the visit with the medical practitioner. After the pre-participation examination is completed, the parent will need to submit one single form, which is the medical eligibility clearance form on page 4. Pages 1 through 3, which are the history and physical forms, can be retained by the parent. The school may recommend turning in all 4 pages of the forms, or the parent may choose to do so, but the minimum standard for all CHSAA schools will be for the family to submit page 4, the medical eligibility form. Pertinent medical information for the individual athlete should be comprehensively listed on this medical eligibility form. It is important to note that accurate medical information and emergency instructions on the PPE form are essential in order to promote safety of student athletes. For more information regarding the PPE, please refer to the school's website and the CHSAA website.
Hello, my name is Dominic DeManna. I am a licensed athletic trainer and a member of the CHSAA Sports Medicine Advisory Committee. It has been well established that schools have emergency plans that will be implemented in the event of an unforeseen situation or a severe weather threat. For example, fire drills, lockdowns, and other types of exercises to increase student safety. These plans are published and distributed to all members of the school committee, the school district, and individual schools themselves. These plans are rehearsed at various times throughout the year and improved on a regular basis. But what about athletics and activities? Since 1982-1983 school year, the National Center for Catastrophic Sports Injury Research has recorded more than 3,000 catastrophic sports-related injuries among high school and collegiate athletes. Across high school and collegiate sports, football, basketball, track and field, wrestling, soccer, and baseball have the highest rates of catastrophic sports-related injuries. The leading causes of death during or resulting from sports participation are sudden cardiac arrest, traumatic brain injury, and exertional heat stroke. These conditions have been discussed in other portions of our video series. Spinal cord injuries account for a large number of non-fatal catastrophic injuries. Based on this information, athletic and activities programs should place the same emphasis on planning for unexpected or unforeseen medical and weather events during a practice or an athletic contest. Consider medical emergencies, concussions, lightning, hail, severe wind, and poor air quality. A well-developed emergency action plan and proper training will result in fewer and less severe athletic injuries. A poorly prepared plan will likely lead to a disorganized evacuation or emergency response, resulting in confusion and increased severity of injuries. Schools should have a written venue-specific emergency action plan that is distributed to and reviewed by all staff members, including administration, coaches, facilities personnel, and any available medical personnel such as nurses, athletic trainers, EMTs, first responders, and team or consulting physicians if they are available. Plans should be practiced and updated at least once a year, and if practical, shared and practiced with local EMS departments. On-site equipment that may be needed in an emergency situation should be listed in the plan. Items such as AEDs, first aid equipment, and so on. Personnel who have keys and can access doors, rooms, gates, and roads should be included in the plan. The EAP should identify personnel, their responsibilities for carrying out the plan of action, and include a chain of command. A chain of command for athletics should include school administration, nurses, coaches, and any available medical personnel such as athletic trainers, EMTs, emergency responders, team or consulting physicians if they are available. Facility address, location, and contact information for both the school and EMS departments should be included in the plan. We should also include a campus or facility map with directions and access points to the athletic facilities. A method for contacting parents in the event of an emergency is also essential and again should be included in your plan. The EAP should specify actions that should be taken after an emergency has occurred. Healthcare professionals who will provide medical coverage during games, practices, or other events, again, should be included in the planning process and in the plan itself. The bottom line is this: plans should be specific to each venue where activities are taking place. Plans should be updated and rehearsed on at least an annual basis. Emergency action plan practice sessions and updates should be documented and kept on file to ensure accountability. A pre-event medical meeting or medical timeout should occur before each event so that the EAP can be discussed with all available medical personnel and others who will be responding in the event of an emergency. Don't forget to include coaches, administrators, and security personnel. This may all sound overwhelming at first, but remember that CHSAA does require that member schools have venue-specific emergency action plans in place, and that these plans include the information and steps discussed in this video. The CHSAA Sports Medicine Committee has also produced and made available a sports medicine handbook that includes all of the necessary information for formulating an effective emergency action plan for your school. This handbook is available on the CHSAA website at chsanow.com.
Hello, my name is Kevin Clark, and I'm the Director of Athletics and Activities for the Thompson School District, and I serve as the Chair of the CHSAA Sports Medicine Committee, or to some, known as the SMAC Committee. I'm fortunate to serve with the committee of experts from all areas. Our committee is made up of physicians, surgeons, athletic trainers, and school administrators who prioritize student safety. The Sports Medicine Committee meets throughout the year and discusses current trends and best practices for player safety, risk minimization, and sports medicine. In my opinion, the best thing that the SMAC Committee has put together is the resources we have available to guide schools when it comes to making decisions. With recent fires, you may have stakeholders asking if it's safe to practice outside. I know I can turn to my SMAC handbook and have a guide that gives me recommendations for different sports and activity levels, protocols for postponing or canceling events based on AQI readings. On hot days, I have a guide for measuring wet bulb globe temperatures to reduce heat-related illnesses to my student athletes. I also appreciate having recommendations and protocols for cold weather games and practices. These guides help keep everyone on the same page. The last section that I'd like to highlight is the access to mental health resources. I believe these resources help address the mental and emotional well-being of our student athletes. Whether it's sports medicine information for coaches, parents, or players, go to chsanow.com and click on the sports medicine icon. I know personally I encourage my athletic directors, coaches, and athletic trainers to also go to CHSAA Now. Our sports medicine page has all the best resources for player safety, risk minimization, and sports medicine. We are in an era of heightened awareness when it comes to sports medicine. As an administrator and former coach, I have found the resources on CHSAA Now to be a great guide. They feature the best practices and information on emergency action plans you can't find anywhere else. A special thanks to our SMAC team for prioritizing Colorado student safety.